Thank you, Mr. Chairman. Thank you all for being with us today and your willingness to serve. I want to follow up on where Senator Young started, and that is, I want to talk about another part, though, of tackling the opioid crisis, and that means making sure that people have access to treatment. You know, as Senator Murphy noted, the law says that insurers must cover treatment for mental health and for substance use disorder on par with the coverage provided for physical health treatment. Insurance policies are required to treat mental health needs and addiction the same way they treat broken bones or a busted knee. They're all medical conditions. They all get covered. That's the law, but it doesn't always play out that way on the ground. A 2015 study found that nearly twice as many respondents were denied coverage for mental health treatment as for other medical treatments. And the numbers aren't great on addiction either. So let me start there. Dr. mccance-katz, you've been nominated as Assistant Secretary for Mental Health and Substance Use. Is trouble getting insurance coverage for mental health or addiction treatment a problem in effectively treating these disorders?
Coverage is a problem for many. Access to care is a problem, perhaps I would say for most.
For most.
For most people.
From many to most.
With these issues.
So I want to underline this because I think it's really important that we do more to make sure that insurance companies follow the law. Right now, patients are often on their own trying to do battle with insurance companies. We're not helping them out by backing them up in these battles. When I helped create the Consumer Financial Protection Bureau, the CFPB, we had a problem with consumer financial products like credit cards and mortgages and student loans where lenders just didn't follow the law. And the CFPB set up a complaint system. We tracked those complaints, and it helped make sure that companies address those complaints, and we made it all public. So anybody can go online at cfpb.gov and they can search and see what companies follow the law and see what don't. So let me ask you this, Dr. mccance-katz. Do you think that making sure that insurance companies follow the law when it comes to parity for mental health conditions and addiction treatment would help in our efforts to tackle the opioid crisis?
I do believe that. I believe that there's been a history of, I think the word capricious is not too strong, restrictions on the kinds of evidence-based treatments that people should have access to. You and I discussed this when we met, and I believe that people should have access to knowledge based on what their peers and community members have experienced to help them make decisions. And in doing that, that can bring a simple kind of enlightenment, if you will, to insurers as to how they need to do things in a way that better serves Americans and follows the law.
Good. I like that. You know, in fact, another way to say it is it helps make the market work better because everybody can see right out there in public. You had a place to file a complaint, what happened to that complaint, which insurers are getting lots of complaints, and which insurers are not, and trying to change their behavior. And I think that's at least one way to try to take the parity that's in the law and make it a reality for families who are struggling with this. You know, Congressman Kennedy and I introduced a bill for this in the last session, and it had an online portal to be able to track complaints about failure to cover mental health and addiction coverage. I think we go even further, making sure that patients actually get responses to their complaints and making the data public about which insurance companies are the worst offenders. So, Dr. mccance-katz, if you're confirmed, I hope we can continue to work together on this. I think we could do a lot of good for a lot of families. Thank you.
I would look forward to it, Senator.
Thank you.